Scientists has discovered that bowel cancer cells can shapeshift, allowing the disease to spread and resist treatment. According to a study from Cancer Research UK's Scotland Centre and the University of Edinburgh, cancer cells can mimic skin or muscle cells to enable them to spread around the body. Dr. Kevin Elliott is from the Institute of Genetics and Cancer at the University of Edinburgh.
So if you think about the different tissues in your body, the skin is particularly resilient and robust. So what we think is happening is that they're taking on the properties of skin to become more resilient, more robust, and that allows them to spread and survive in different organs. So it makes it much more aggressive. It makes it harder to treat, so they don't respond as well to therapy either. So overall, it's a way that the cancer cells can kind of survive in hostile environments.
Well, Dr. Catherine Elliott is from Cancer Research UK. Thanks very much for coming on.
Thank you.
How significant is this discovery?
Yes, this is a really interesting discovery from the Cancer Research UK funded team at the University of Edinburgh. As Dr. Myers just explained, it really helps us understand better how cancer cells can invade from where they start off in the bowel and move around the body to become metastatic growths. And we know that it's in those more severe aggressive forms of cancer that outcomes tend to be much worse. So it's really important to understand how cancers change from just being localized in the bowel to being spread throughout the body, and so that we can, eventually develop better treatments and ways of detecting those metastatic cancers to improve outcomes for patients.
So, although this could sound like it's a bad news story, the fact that they can shapeshift and move around, what it actually allows you to do is to think of ways to treat them.
Yes, exactly. And because what the team have found as well is the genetic and the cellular triggers that help those cancer cells shapeshift like that. So what we might be able to do is then find therapies and treatments that stop that happening and can actually interfere with the cell's ability to shapeshift and kind of move their way around the body in that way.
How are we in terms of treatments for bowel cancer at the moment?
Yes, so at the moment, for many cancers, in fact, survival is improving. Treatments are improving thanks to research all the time. But with bowel cancer, as with almost all cancers, what we see is that when cancers are found early and they're detected early, often thanks to screening programs, then outcomes are much better through both surgical and medical and radiotherapy treatments. As cancers become more advanced, and as we were just talking about, as they spread around the body, treatments become, more difficult, and survival becomes sadly worse.
And we're seeing a rise in cases among younger people. Is that right?
Yes, that is right. Both in the UK, all the nations of the UK, but also in many, particularly higher income countries across the world, we are seeing more cancers being diagnosed in people aged 25 to 50. And that's been a steady increase really since the 1950s, but it's a continued increase and something that we're concerned about and funding a lot of research to understand better.
Dr. Elliott, thank you so much for coming on to speak to us. Dr. Catherine Elliott there from Cancer Research UK. It's just coming up to 5 to 1 now.